Hi, everyone. Thanks for tuning in. My name is Lydia Ramsey Pflanzer, and I'm a healthcare editor at Business Insider. I'm here today with Greg Adams, the CEO of the California-based healthcare company Kaiser Permanente. Greg has had a big first year on the job starting in December 2019 after the unexpected death of Bernard Tyson in November of last year. And just a few months into the job, the coronavirus pandemic happened, putting enormous strain on the U.S. healthcare system as it scrambled to handle a surge in patients while simultaneously learning how to treat the condition and protect themselves with the proper protective gear. Starting in May, the U.S. confronted systemic racism amid protests sparked by the police killing of George Floyd. The disparities in racism that exist in healthcare came to the forefront of the conversation, leading to difficult conversations and bringing into focus the disproportionate way the coronavirus pandemic has been hitting communities of color. Well, we've made it to October, Greg. So the first question I want to ask you is, how are you doing?
I'm doing well. Thank you, Lydia. I'm doing well. Kaiser Permanente is doing well. Thank you.
Yeah, for sure. Yeah, and so let's talk about this past year. You know, a year ago, I was out at Health, back when I could hop on a plane and go to Vegas. And I was tuning into probably one of Bernard's last appearances before his unexpected passing. You know, how has it been navigating this transition?
Thank you. You know, just a couple of thoughts. Bernard was first and foremost a great friend, and he was a great leader. And it has been a challenge for everyone at Kaiser Permanente to experience his loss. He and I worked very close together for a number of years, and much of what Bernard was passionate about, I'm passionate about, improving the affordability of healthcare, addressing access, addressing healthcare disparities, social determinants of health. So, you know, when Bernard passed and when I stepped into the position, I was committed to kind of continuing his vision, continuing the things that we had in front of us. But I was also looking at, you know, what things that we need to own differently. And so we were focused on expansion. We were focused on having the organization operate more as an enterprise. So there were a number of things that we were beginning to move forward with. And then the pandemic hit. And it was, you know, it was really a situation where one had to step back, kind of look at, I had to look at my leadership, look at the agenda that I had, and really to shift in the moment to do what the pandemic and the organization called for and needed from me at that time. The good news is that I think much of that was aligned with strategically where I felt the organization needed to go. I felt we needed to move faster. I felt we needed to operate more as one. And we moved quickly to do that as a single enterprise. Physician, nurses, our market leaders, everyone came together. We organized, and we've been leading and executing and addressing the issues in our communities and the issues in our medical centers and care centers as a single enterprise. We've moved forward with, you know, advocacy work, developing playbooks around the pandemic. So I think in many ways, the pandemic accelerated the journey that we needed to take. I mean, we moved over a matter of weeks from 20% virtual care visits to 80% virtual care visits. You've heard that story. In many other organizations, we're now at about 50, and we're really looking at how do we create the new normal, because we know that much of what's happened through the pandemic, much of it will stay with us going forward.
Yeah, absolutely. And when thinking about that, kind of bringing everything together and kind of keep getting everyone on the same page, what's kind of a good example of that? You know, I guess, where have you seen that really shake out, where, you know, in the past you've done it this way and now you're doing it another way?
Yeah, well, you know, I think the virtual visits obviously is one. In the past, every market kind of approached that in their particular way. We've hardwired how we're doing it. We're doing the same way across the organization. I will tell you, during this process, believe it or not, we actually have developed a new strategic plan for the organization. So as we've been focused on the pandemic, taking learnings from the pandemic, we've engaged with the organization, we've engaged with the board, and we've really focused on how do we understand what's going on right now, what disruptors do we see, what are we being called to address in terms of healthcare disparities, what are we being called to address or to do in terms of leadership in our communities, and how do we bring all of that together and as a single organization kind of move forward over the next 5 years, really evolving and creating kind of the vision that we have for Kaiser Permanente.
Yeah, that's really interesting. I know it's one of those things where I'm finding myself, reflecting on what these first couple, I guess 7 months have been like for us. And it's really one of those moments where any issue that ever was an issue in the past is something that we all kind of have to be grappling with all at the same time right about now. And it's hard some days, but in other ways, it's a good thing to be working on. And I wanted to talk about a little bit about, it's been 7 months since the pandemic hit, and it left behind this legacy of financial pressure on providers, big and small. Kaiser obviously has a little bit of a different model out there that puts you guys in a different position. Walk us through what that's been like, seeing kind of in-person visits drop, seeing elective procedures first go offline and then start to come back.
So at the beginning of the pandemic in March, when none of us really knew what was going to happen, but we had expectations of large numbers of people coming into our medical centers, and we did the right thing by delaying elective care and really creating capacity for us to be able to take care of those people that we knew were going to be coming into our organizations. We were able to do that. We did that, I think, very effectively in the Mid-Atlantic part of the country. We set up our ambulatory care centers to be ready to actually operate as hospitals. In California, throughout California, we increased our capacity by, in some cases, 60%. We had portions of our ambulatory centers that were ready to take care of inpatients. We very early in the pandemic began to advocate and to say that we needed to move from containment to mitigation. And we saw very early that the virus was in the community, and we were very concerned about protecting our employees, about the spread. So we developed a number of playbooks, prepared the organization, but also shared those externally in terms of what at the national level, at the state level, really advocating for us to move to mitigation. Then, of course, we've been able to do that. I will tell you, just reflecting on leadership for a moment and kind of what everybody had to do. When I say we had to lead in the moment, it was different in the sense that, we're used to thinking and having plans and delegating, and all of that is very good. But in the moment, it really had to become more directional. This is what we must do. This is a timing. And I think the organization responded very well to that. And that also helped us to create that enterprise-wide approach versus a regional or a market approach. And I think when I look at where we are now, and that's really kind of, how do we think about the new normal and where are we going? I think we're a much more agile organization. I think while we've always been innovative, we've also been somewhat timid about having things right. And sometimes perfect. It's been a part of our culture. I think we are much more oriented toward taking risk. So as we look at that plan I talked about, I think we're being much more aggressive in what's in the future for Kaiser Permanente, somewhat related to the cultural shift and the leadership shift that has occurred.
Yeah, it's fascinating. Obviously you guys have a lot of geographies you are working and operating in, and obviously those places have kind of seen surges in coronavirus cases at various times. But I think it's one of those things where I'm sitting here in Brooklyn and I'm starting to see the case counts go up, and I'm wondering, what are you guys bracing for as we kind of look at what these next kind of waves hold going into the winter?
Yeah, I think across the country and in all of our markets and at a leadership level, whether it's state or federal, we're all thinking and preparing for the winter. Mm-hmm. I think the first part of preparing for the winter is really doubling down on wear a mask, social distance, wash your hands. We actually just put out kind of PSA, Kaiser Permanente communications with our clinicians, our frontline nurses, our doctors, saying this is real and this works. I mean, hoping that hearing from clinicians, hearing from people at the bedside, that will have an impact. So I think doubling down on that message and being very clear about it, which is hard to do in today's environment when there's so much noise. But I'm hoping that we will be credible and clear and help people understand that this is real. I think the second thing is we all must prepare for the flu. The issue of the flu and COVID at the same time. The second wave is a bit scary. And so it really kind of leading, advocating, making the flu vaccine available in ways that we've not done previously is really important. I think it's also important that we try to open society, and we've got contact tracing, we've got all the tools in place, because there will be outbreaks, and the issue is, what do we do and how do we handle them as healthcare systems? How do we handle them as a public health department? How do we handle them as a state? All of that is very important. So really working at the state level, working to make sure that we have contact tracers and support for the kind of surveillance programs that need to be in place. In California, we actually made available some $63 million for the state to use, having teams that can work with kind of communities, Black and brown communities, to make sure that the resources are available to help people deal with issues of quarantine and isolation, et cetera. So I think that's important. And then, of course, we have to be prepared in terms of our medical centers. So, we're working with our staff, working with our physicians. Our physicians and our frontline staff have been amazing through this period of time. And so being there with and for them, supporting them, being prepared to bring additional staffing in to create additional capacity if it's needed. I truly hope, hope is not a plan, but I truly hope as we plan, if we are diligent in our communities, if we own what we've got to do in terms of social distancing, isolation, and when we get the flu shot, I believe that there is a chance that we will get through this. At the same time, we know the risk, and we have to be prepared for a second wave coupled with the flu that could be very large.
Yeah, absolutely. I'm sure it's nice to have a lot more headspace to wrap around and planning and getting that figured out compared to back in February and March. And I wouldn't be a good health reporter if I didn't mention that I have gotten my flu shot. So on the right track.
There you go.
Now, I wanted to talk a little bit too. You mentioned, carrying on some of Bernard's legacy and kind of the planning you're doing, and obviously the pandemic kind of threw a wrench in things in some ways, but to your point, kind of accelerated in other ways. I remember reading back in 2018 and talking to Bernard back then about Kaiser's $200 million commitment to reduce homelessness, and I wanted to talk about how that's been going. Have you guys been building on that? Have you started to see evidence that that's working in a way of getting people healthier?
Yeah, thanks, Lydia. I apologize, but I can't just go there without going to kind of what's playing out in our world today, because, homelessness was an issue, 550,000 nationally when we were looking at this in the past. Today, it's even more of an issue. The pandemic, the implications for Black and brown communities, the civil unrest, the environment. So while I'd like to say that there's been time to thoughtfully think this through, there's been so much going on that we've still had to move pretty fast. We made a commitment to homelessness because we, as an organization, have always been committed to the health of the individual, the health of the member, the health of the population. And we understand that the individual, the member of the population, can only be as healthy as a community. And I remember driving through Oakland with Bernard, and he and I were coming from some meeting, and we passed by a homeless encampment. And we were already beginning to kind of think and work, but it was a team, and it was myself and Bernard with his kind of energy and power said, wow, we got to do something. And the next week, I think it was the next week, that a group of us were on a bus and touring all of the homeless encampments in Oakland. We didn't tour them all, but we toured a large segment of them. And that led to the $200 million grant that you've mentioned. We've spent about $33 million of the initial grant. working with community-based organizations and others to have an impact on homelessness. So I would say yes, we're working and we're having success. I think one of the most things that I'm proud of is what we've been able to do in Oakland through our community health organization. We identified, I think it was like some 500 people in Oakland that was homeless every night that had medical conditions, clinical conditions. Over a short period of time, we were able to get all of those people off the streets and in housing with medical care. So it's a journey. We're still engaged. We're still working. Our commitment is no less. It's actually greater than it was, and the situation today calls for it to be greater.
Right. Yeah, I wanted to talk about that a little too. And I know you guys have some news coming out around health in this kind of vein, but thinking what's going on in the world, what has really the pandemic exacerbated as far as the social determinants of health and the role they play in communities' health.
There's so much going through my head. I mentioned that we just finished our strategic planning in the middle of all of this, and it's so informed our plan. So I'm gonna go there. But I want to talk a little bit about doing a strategic plan in the middle of a pandemic and in the middle of all that's occurring was just phenomenal. So there are a couple of things that we are coming out of that committed to that will connect back to your question. One is as a board, we made the decision that we would own healthcare disparities for all care that we provide. Now, I haven't quite figured out how we're going to do that, but we've led the nation, in looking at healthcare disparities. We've focused on diabetes, hypertension, colorectal screening, cancer screening, and a few others, and we're doing extremely well. The point that the board made and our quality leadership was owning it for a few conditions when we look at what the pandemic is kind of laying bare to all of us is not sufficient. The healthcare in this country, and certainly Kaiser Permanente, must step up and own it for all care that we provide. So we're moving to bring ethnicity and race into our evaluation of our quality and care across the organization. We actually have a statement where we're saying that we will elevate equity and inclusion to the same level of care, of quality and service in our organization. And a lot of this is coming from what we're seeing and what we're understanding about the world and about where healthcare is. So when we look at the pandemic, and we all have heard and know that brown people are dying at a rate much higher than others. Blacks are dying higher than any. Latinos are 44% more likely to contact the virus. Well, we've been engaged with our membership, and we've surveyed since I think the beginning of the year some almost 9,000 members, and then in March we added questions about COVID. And what you see across the board is that people are pretty challenged. I mean, 62% of the people of our membership survey said that they have at least one social factor that they're struggling with. That could be jobs, that could be food. I think over 36% said it was two or more. So people are struggling. They're struggling accessing healthcare. They're struggling making ends meet. Our Latinx and African American members said that they only had that if they were unemployed for 3 months and didn't have an income, that they would not be able to make it. So the challenges that this virus is creating is pretty significant. And I think, Lydia, we have a video that we might show that actually highlights one member that kind of brings all of this together and really helps us to frame what we've done in our plan and what we're doing going forward.
At this age, I just kind of feel like I'm too damn old to be facing this, but so many people face it. What happened with me was my job was underpaid. and I had more expenditures than I had income. In the end, I was put out of my place for basically a month's worth of rent. At the same time that I was scheduled to leave the apartment, my job was ending as well. I decided that, I'll start afresh for my car. There's always this sinking feeling now that I'm not of the citizenry anymore. I'm of another class. So while I was living in my car, I had a pulmonary embolism, I had pneumonia, and then I also had infection in the blood or in the kidneys. Knowing that I was very sick was the motivator. I said, hey, I need to get social service help. So I called 211, and then he told me, you need to go down to the Bay Area Community Services. With every fiber of my being, I just decided that that's what I was going to do if I had to crawl there. At that point, they got some funding. He said there was this house that was going to be finished, and I remember her telling me that it's going to be incredible. I ended up, with my own room, and that's just beautiful for me. Housing is keystone. It's what holds everything else together. Housing has allowed me to access parts of my life that I thought were gone. It's allowed me to access work. It's allowed me to access medical care, improves my mental health, and I'm able to build a new life. I get to go and be a real productive member of society. You see people getting up, going to work. Those are the heroes. And this house has given me a chance to be a hero.
So Victor's story, I think, is an example of what so many people in this country are dealing with. And as we've looked at kind of how do we kind of own this going forward, and I'm going to take you back to our planning. But one of the things that we committed to as a strategy is that we will integrate social health into our care model at the same level as we have physical care, clinical care, and mental health. So when we think about care for our members, for our patients, for our populations, it is not just, are you getting prevention or are you getting good clinical care? It is, are you getting care that addresses your social, your physical, and your mental needs?
Yeah, and I'm really sorry to say that we are running out of time, and I'm really looking forward to catching up in the future and hearing how that goes. It sounds like a really important mission, and it's as a healthcare reporter, it's something I think about a lot. Is what role do healthcare institutions need to play in the overall well-being of people? But so thank you so much, Greg, for taking the time, and thanks so much, Health, for having us.
Thank you, Lydia. Thank you.